Hi, I'm Jonah, and today I'm going to talk about stigma and discrimination around mental health issues. So, why is this important? Stigma and discrimination surrounding mental health issues remain significant barriers to care and recovery for millions of individuals. I have chosen to present this issue because I also have been a perpetrator of and a recipient of mental health stigma and discrimination. It was not until recently that, through clinical experience and working around with patients experiencing mental health crises and issues that I had the kind of like a change of heart. For context, I recently finished a clinical rotation at a mental health facility wherein our role in the clinical environment was observational in nature. However, we also got to have discussions and were able to learn a lot more about these patients who were suffering from a very harsh mental health diseases, such as bipolar disorder and schizophrenia. In the process of getting to know these individuals, it became apparent that these individuals are pretty much like everyone else, but they just need a little bit more help than the average person to get through the day, whether that be socially or medically. Further, I have suffered the consequences of mental health distress in my life as well, and have had hesitancy in receiving care. As such, this issue was also chosen because the persistent stigma associated with mental health illness prevents many, like myself, from seeking care and treatment. Furthermore, discrimination in healthcare settings, workplace, and society at large exacerbate the challenges faced by those with mental health conditions. Addressing stigma is crucial as it directly impacts access to care, treatment, adherence, and overall well being. Impact on healthcare context via discrimination, stigma. Um, the stigma and discrimination surrounding mental health significantly impact the healthcare system. Many individuals experiencing mental health issues delay seeking care due to fear of being judged or labeled, which can lead to worsening symptoms and preventable crises. Healthcare providers sometimes unknowingly perpetrate stigma as well through biases and inadequate understanding of mental health needs, leading to disparities in treatment quality. Further, the limited integration of mental health services within primary care settings creates barriers to timely and appropriate interventions. These challenges contribute to the underdiagnosis and undertreatment of mental health conditions, exacerbating negative health outcomes. But how does this affect the patient's health outcomes? Well, the stigma associated with mental illness leads to several adverse client outcomes. First, the fear of judgment or discrimination often results in delayed treatments, which can escalate symptoms and increase the likelihood of psychiatric emergencies. Um, Further, there's risk of suicide, and suicide remains one of the leading causes of death in the U.S., with over 48,000 deaths a year contributed to suicide, many of which are linked to untreated mental health conditions. Individuals who do seek care may struggle with adherence as well to prescribed treatments due to internalized stigma or external pressures. This non-adherence also leads to poor disease management and recurrent hospitalizations, especially emergency room visits. Third, untreated or poorly managed mental health conditions increase the risk of comorbidities and other physical illnesses, such as cardiovascular disease and diabetes, further complicating the patient's care. Um, Patients who also perceive stigma towards them within the healthcare setting may be less likely to have follow-up treatment as well, such as screenings, um, which could also diminish their long-term health prospects and affect their health outcomes in a negative capacity. Um, Discrimination and stigma also have an impact on patient safety. This is associated with negative health outcomes, as aforementioned. The consequences of stigma and discrimination extend beyond as well, um, impacting safety at multiple levels for the patients themselves. The stigma increases the risk of self-harm, suicide, and substance abuse as they struggle to, actually cope with their mental health disorders as they don't receive treatment for it. Data shows that individuals with serious mental illnesses are at least twice as likely to develop substance use disorders. Um, and the families are also affected. Families can experience emotional distress, financial burden, and strained relationships with their loved ones because of their health challenges. Healthcare professionals, they encounter safety concerns as well as experience burnout and compassion fatigue when working with stigmatized populations in a crisis setting, especially if they're going underdiagnosed or they're misdiagnosed or um, they're untreated. I mean, dealing with somebody who's having a mental health crisis over and over, whether it be the same patient or different patients, it can, from personal experience, I mean, it leads to a lot of burnout. On a societal level, the failure to address mental health stigma contributes to increases in homelessness, unemployment, and incarceration rates, which can have a financial burden. Approximately 26% of homeless individuals in the U.S. live with a serious mental illness. The number is even greater for patients experiencing any mental illness. Um, this really highlights the broader societal impact that stigma can have in patients not receiving adequate care. Talking more on the financial impact, um, the financial burden, stigma, and discrimination regarding mental health is great for both individuals and society. Many patients face high out-of-pocket expenses for therapy and psychiatric care because a lot of insurance companies just don't cover it, or don't cover it enough. Um, you know, the average cost of like a therapy session can range from $100 to $200 a week. For many individuals who don't have adequate health care coverage or insurance, that's just not affordable. Additionally, medication costs, treatment can be a significant financial burden on top of that. Antidepressants, antipsychotics, any other medications that the patient might need for any comorbidities, they all add up. And especially, if you have a mental health disorder, it becomes harder to work, which, just further increases the financial burden strain. Mental health stigma also contributes to the loss of wage and reduced workplace productivity, which, as aforementioned, causes strain financially. It is estimated that about $280 billion annually can be attributed to the loss of productivity and critical treatment needs for people with mental health crises or disorders. Um, Employees in the workplace can face discrimination due to mental health conditions as well. Um, Even though you don't have to disclose your struggles, um, this can lead to decreased performance, absenteeism, and even job loss, just because of the stigma. On a broader scale, the economic impact of untreated mental illness is staggering, um, because of emergency room visits and psychiatric crises that develop as um, people go undiagnosed or untreated, and it all eventually boils up into emergency room visits, and which can be frequent and they're very expensive. um, Furthermore, there's the impact of the criminal justice system and the incarceration of people with mental illnesses. Um, the criminal justice system bears a significant financial burden, as 37% approximately of incarcerated individuals have a diagnosed mental illness. The cost of housing people with mental illness in these correctional facilities is very high, and I believe it's considered to be higher than um, the appropriate community-based treatments like mental health facilities or actually getting treatment. Um, Further, there's high employee turnover rate in workplaces and hospitals, even in incarceration facilities, which add to the societal costs of under-addressed mental health stigma. Additionally, disabilities benefits and government assistance programs must provide support for individuals who are unable to work due to the severity of their mental health conditions, which, that's where your taxes go. So, I mean, you're paying for it too. Everyone's paying for it. Addressing stigma and improving access to mental health treatment could significantly reduce these financial burdens by preventing crises, improving workplace productivity and decreasing reliance on emergency and correctional facilities. Um, yeah. What are some regulatory factors? Well, there are several laws and policies that have been enacted to address mental health stigma and improve access to care. The Mental Health Parity and Addiction Equality Act ensures that insurance plans provide equal coverage for mental health and substance use disorders, preventing discriminatory limitations on treatment. The Americans with Disabilities Act protects individuals from workplace discrimination, ensuring equal opportunities for those with mental health conditions. Additionally, the Affordable Care Act has expanded mental health services, increasing accessibility to care for millions of people and patients. Um, Despite these advancements, reimbursement barriers persist. Um, there's discouragement for providers to enter the field of mental health care as they receive lower reimbursement rates and lower pay for working with mental health clients. This can lead to financial disincentive for providing psychiatric care or mental health awareness and care. This contributes to the ongoing shortage of mental health professionals, further limiting access to services. Additionally, insurance plans may impose high co-payments and restrictions on the number of therapy sessions covered, making continued care for persons with mental illness to be financially burdensome. Um, this goes into the reimbursements as a regulatory factor. Um, while regulations have improved access to mental health services, barriers still remain, unfortunately. The enforcement of parity laws is inconsistent, leading to continued disparities in coverage for mental health treatment. Many individuals still encounter limitations such as high deductibles, restricted provider networks, and authorization requirements that delay or prevent access to care. Further, the lack of primary funding for mental health services remains a significant issue. Mental health care is often not a primary focus in the primary care setting, making it harder for individuals to receive comprehensive treatment. Integrating mental health services into primary care funding would ensure that mental health is treated with the same urgency and accessibility as physical health. Um, Financial barriers also persist, discouraging both patients from seeking care and providers from entering the field, as aforementioned, because of the low reimbursement rates that you can get from insurance companies. Um, So, to build upon the progress made by existing regulations, policymakers should ensure equitable insurance coverage, reducing financial obstacles, and integrating mental health care into broader healthcare systems, strengthening enforcement of parity laws so that the inconsistencies don't lead to a decrease in coverage for patients. Um, yeah, so I jumped ahead of myself. Yeah, but improved access but barriers remain. Um, with the parity laws and being able to get insurance coverage. So more integration of mental health into primary care is needed. So increased funding would be a step towards that and making sure that there's equitable healthcare access for people with mental health disorders. What is the nurse's role in advocacy? Um, the nurse's primary role for the patient, the mental health and advocacy is addressing stigma. One crucial responsibility is educating patients and their families about available mental health resources, ensuring that they are aware of support systems and uh, aid systems that can aid in their recovery. Nurses also have the power to promote stigma-free environments within healthcare setting, by being non-judgmental themselves and educating their peers about mental health stigma, supporting policy changes as well, like increasing funding for mental health services, improve insurance coverage is another key advocacy effort. Um, Nurses can also be advocates in reforms to ensure mental health parity, insurance coverage, in a legal setting, making sure that legally people with mental health illnesses are able to get the care that they need. Additionally, integrating routine mental health screenings for patients, can help identify issues early and stop misdiagnoses or underdiagnoses. Um, for these efforts, nurses can be essential advocates for systemic change and actually help people with mental illness. In conclusion, stigma and discrimination surrounding mental health continue to present significant challenges to access, treatment, and overall well-being. These barriers impact healthcare quality, safety, and financial costs, making it essential to address stigma at both the individual and systemic levels. Even though there's existing laws and policies that improve mental health service access, gaps still remain. So nurses at the forefront, working in primary care, working in behavioral health settings, should be advocates for change, using their knowledge and influence to educate, promote policy, reform, and create stigma-free environments and stop the discrimination of people of mental illnesses. Thank you. Is the works cited?